Thank you so much for being here today. I'm going to take off my mask because we're spatially distanced and so that you can hear me, and we'll put it on before I leave the podium. So, my goodness, good morning. Thank you so much for coming out to Planned Parenthood today. I am Ken Lambrecht. I'm the president and CEO of Planned Parenthood of Greater Texas, and we welcome you to our new building and facility. Today we're thrilled to announce the opening of our Lubbock Health Center. With COVID-19 in conversations every single day in the news here in West Texas, we recognize that this community needs more access to time-sensitive, essential health care than less, and Planned Parenthood is thrilled to be part of a solution in West Texas, and we're thrilled to now have a health center back in Lubbock. Appointments are now available online through our website, and we're scheduling both in person and through for telehealth visits, and we already have patients scheduled for early next week, and we're very excited about that. This health center is going to offer breast and cervical cancer screenings, HIV testing and treatment for sexually transmitted infections, all FDA-approved methods of birth control, including IUDs and implants, PEP and PrEP for the medication for the prevention of HIV, treatment for urinary tract and vaginal infections, annual well-person visits, HPV vaccines, flu vaccines, and other essential preventive healthcare services. Planned Parenthood provides access to affordable health care. We recognize that uninsured patients may be eligible for patient assistance funding with us for birth control, breast and cervical cancer screenings, sexual STIs, sexually transmitted infection testing and treatment, and human papillomavirus vaccines that help prevent cancer. Planned Parenthood is a trusted brand. We are experts in healthcare. We are experts in education, and we are part of the healthcare safety net, serving communities in Texas for more than 85 years. We have 23 health centers in our service area in Texas. Lubbock will make 24. We have health centers in Austin and Dallas, Denton, El Paso, Waco, Fort Worth, Paris and Tyler in East Texas, El Paso, as I said, in West Texas, and we are now thrilled to be open here in Lubbock. We've been in the United States providing health care for more than 100 years, and we serve more than 3 million people nationally. All are welcome at Planned Parenthood, regardless of insurance, documentation status, income level, where you live, or who you love. We want you to come here for care. Our health center manager, Angela, is going to talk more about this shortly, and we're excited to hear from her. For the past 3 years, Planned Parenthood of Greater Texas has had as a priority to expand access to West Texas. We opened in El Paso in 2018. We expanded through our telemedicine app, Planned Parenthood Direct, for both birth control and urinary tract infection testing throughout West Texas in 2019 and throughout the state. And now we are opening a new health center here in Lubbock. And we're thrilled to be doing so. Texas has among the highest uninsured population in the United States, and healthcare disparities are disproportionately impacting the poor and people of color in our state. And Lubbock has STD rates and unintended pregnancy rates that are worse than the state of Texas as a whole, and Texas is already bad, and it's worse than the state and federal averages in the United States. We have a higher uninsured population rate here in Lubbock than even in the state of Texas, and as I said, Texas has the highest uninsured population in the United States. As a nonprofit organization, we are committed to expanding access to care while investing in the health and safety of communities, creating healthier communities. This health center is funded completely by private donors, so all of our funding is private. Planned Parenthood is fortunate to have the support of individuals and foundations who believe that people deserve access to health care regardless of their income, regardless of their insurance or documentation status, or who they love. Our donors recognize that funds invested in preventative family planning services ensure that Texas women are healthier, families are healthier, and communities are healthier when Planned Parenthood is part of the community. We're proud and incredibly excited to be part of Lubbock's friendly and diverse community, and Planned Parenthood is also committed to providing and protecting access to safe and legal abortion services. We are a trusted provider of medication and surgical abortion, a respected advocate for abortion access in the United States and in Texas. We believe the right of all people to make their own healthcare decisions. We trust women to make their healthcare decisions, and we believe politicians do not have a place in this conversation. With that being said, we know that women make decisions with their family, with their doctor, and with their faith, and we are here to provide any and every constitutionally protected service that they would like to access. We are familiar with politicians who seek to ban abortion or dictate under what circumstances someone can seek an abortion. And again, we trust women, not politicians, to make private medical decisions and decide whether and when to seek an abortion. We plan to provide medication and surgical abortion services at this health center during the year ahead. We know that anyone seeking an abortion in this area has had to travel extensively, if they're able to, out of state, as far away as El Paso or Dallas or Austin for the closest health center providing safe legal abortion, and it creates enormous barriers that we plan to remove within the next year. And now I am delighted to introduce Marilyn Matthew, a Texas Tech third-year medical student, who's also a founder of the Texas Tech Students for Choice chapter. And I'm going to put on my mask before I leave. Thank you.
Good morning, everyone. Like he had said, my name is Marilyn. I'm a third-year medical student here at the Texas Tech Health Sciences Center, and I'm excited to speak to y'all today about a group of people that has kind of fallen through the cracks for a little bit of time, but is really important that we address within our community. So the 2019 Community Health Needs Assessment found that Lubbock had an increased rate above the national average, 11% above the national average, of uninsured adults. What does that mean for our community? What I see are individuals who have to rely on community outreach efforts like the free clinic to get their medications for hypertension, insulin for diabetes, and any day-to-day medications that they could possibly need for their cancers. Unfortunately, organizations like this are not built to give help for large volumes of women in need of many reproductive services. What I see are cervical cancers that could have been screened for, breast cancers that could have been felt for, and pregnancies that could have been wished for. Lubbock continues to lead in teen pregnancy rates and STIs. Young women who themselves should be going to the pediatric care for checkups end up being the mothers of the newborns in the nursery. Spending time with them, you realize that they themselves parallel the stories of their own mothers, leading to poor outcomes, healthcare outcomes for both mom and baby. This is not something we should be proud of, and is something we need to address together. As this pandemic has shown us, health is both an individual and community choice. What affects the uninsured inadvertently also affects the insured. By returning to Lubbock, Planned Parenthood will contribute directly to the healthcare safety net and provide thousands of Lubbockites with essential health care. I am proud to be part of the next generation of MDs, and I stand with Planned Parenthood today. Thank you. I'd like to introduce Angela, our healthcare manager, to talk a little bit more.
What is your last name? Thanks, Marilyn. Thank you, Ken. I'm also going to take off my mask only because my glasses fog up. I can't read. So I'm Angela Martinez. I'm the manager of the new Planned Parenthood Health Center here in Lubbock. I'm so proud to be here today. I'm so excited to announce the opening of our health center. There are a lot of reasons this is important to me, and I wanted to share a couple with you today. To start, I am a Lubbockite. I grew up here. I went to high school here. I graduated from Texas Tech. I loved it so much I went back and got my master's in social work. I am committed to this community and to serving everyone who lives here. I know Planned Parenthood can reach the people in our community who are in need of our health services. I was a patient at Planned Parenthood before I worked here, and I grew up alongside men and women who utilized the health care Planned Parenthood provided when they were under or uninsured. Planned Parenthood is Lubbock. I see it in our clients, our staff, and our volunteers. As Ken mentioned, all patients are welcome at Planned Parenthood Health Centers, regardless of insurance, documentation status, income, zip code, and who they love. It's important to me that people in our community see Planned Parenthood as a safe space. Everyone is welcome, and we will provide the best non-judgmental health care to anyone who needs it. We are experts in healthcare and empathy, ensuring patients are seen, heard, respected, and cared for. For the communities in Lubbock who are underrepresented and underserved, we are a resource for you. For our LGBTQIA friends, you will always be welcome here. We are a resource for timely expert healthcare with appointments provided both in person and telemedicine for all patients. Many of the patients we see are uninsured or underinsured. But with the patient assistance funds that Ken described, they now have one more resource in Lubbock for affordable healthcare services. The second reason that opening this health center is so important to me is because I was on the staff of Lubbock Planned Parenthood when it closed in 2013. The closure was due to loss of government funding for birth control, STI treatment, and other preventative health care, and the impossible new abortion restrictions required by the Texas legislature. After Planned Parenthood closed, many people reached out to me asking where to go, how to obtain an abortion, or how to get emergency contraception. Rural healthcare services are scarce, and too many residents go without a provider. When Planned Parenthood closed after more than 45 years of serving Lubbock and the surrounding communities, I was concerned about the loss of access to essential, affordable, and comprehensive healthcare services, not only in Lubbock, but the Panhandle, West Texas, and even eastern New Mexico. I was raised in Lubbock, and because of that, I was raised to acknowledge every person with dignity and respect, providing an opportunity for women to maintain bodily autonomy and to provide care and compassion to every person. That means Planned Parenthood. That is why, today, I'm so proud to welcome the Lubbock community to our new health center. To my fellow Lubbock residents, you are welcome here. Thanks.
And we do have time. Are there any questions for anybody who spoke today? Yeah? Okay. Okay, great. Do you want to go ahead?
Sure. My first question is, so just to clarify, y'all will perform abortions here in Lubbock?
Sometime in the year ahead. Mm-hmm.
Okay.
Yes, that's our goal for the year ahead.
How do you feel about they're trying to pass an ordinance that would make that illegal in this area. So what is the response to that?
Yeah.
I'm happy to.
Either way, right? Yeah.
You're welcome.
Okay.
Either way.
We're, obviously we're tracking that closely.
I'm sorry to stop you. Would you mind just stepping up to
Yeah.
the mic so we
Sure.
can grab that? Thank you.
So obviously we're tracking the discussions that are happening here at the city level about whether to restrict access to abortion services. We are very familiar with efforts to ban abortion or to restrict access so that it's inaccessible to most people. So we're very familiar with those. We've seen ongoing, frankly, relentless efforts by the Texas legislature to make abortion less accessible in the state. So we're tracking that closely, but we're here, as you heard from Ken, we're committed to making those services available for those who need it, and we'll be here for as long as we can provide those services.
And another question I have is, just to clarify on the abortion thing, is that you said within this year or within the next year?
Next year. I mean, it will not happen in 2020, so sometime in the year ahead, we will be providing medication surgical abortion, and we'll certainly share that update when those services become available.
Can I ask why that's not being offered with the initial services?
Sure. I mean, it's not uncommon when we open a new health center to typically provide our preventive healthcare services, our family planning services, and then to, at a later point, add the additional medication surgical abortion services. So we've done that with other health centers when we open. It's just sort of part of how we start and it's how we set up our health services.
Thank you. Will there be any sort of security outside of Planned Parenthood, or what's that going to look like?
Yeah, absolutely. And then I'll bring Ken up. Yeah, absolutely. We take the health and safety of our patients, of our staff, and of our guests. It's one of our top priorities. So that's, that's built into all of our health centers by design and by staffing. So absolutely, that'll be a top priority for us to make sure everybody is safe and protected here. Yeah. Matt?
So there will be protesters, I'm sure. They've already kind of started. So what would your advice be to women who are maybe hesitant to come here just because they would run into protesters?
Yeah, so, this is not new. It really varies by community community. But as you heard from Ken, Planned Parenthood's been in Texas for over 85 years. So we're familiar with folks who maybe don't choose to have the services that we provide, and that's certainly their right. But what we hear consistently from the patients who walk through our doors, and that's what this is all about, that's why we're here, for the patients that we'll serve. What we hear consistently from them is that they feel cared for, they feel respected, they were grateful for the health care they received, and that's really our focus.
Can you talk a bit about, I think you're taking appointments already. Can you talk about how many maybe has there been kind of a rush of people, or have there been some people?
We just started, I think yesterday was the first day that actually, you could go online and make an appointment. So so that just got started. So we typically, when we open, we'll, as people learn that we're here and learn that the services that they're looking for are available here, we'll start to see an increase. We expect to see a few thousand patients annually. That's typically what we provide in the health centers that we have.
I have a question. So we know that Planned Parenthood here in Lubbock, it doesn't matter who wants to answer.
I was going to say, whomever you want.
So I can
We're
imagine
happy to
that
go
this is quite an emotional experience for you because Planned Parenthood was here and then it closed about 7 years ago. What are changes that have been made, or are there any changes from 2013 to 2020 for Planned Parenthood services, or how you go about things? Is there anything that has changed in those last 7 years?
Planned Parenthood, excuse me, Planned Parenthood of Greater Texas is the largest affiliate in the southern United States of Planned Parenthood, and in a politically adverse area to our mission. We are what used to be 8 separate Planned Parenthood organizations in the state that have merged and formed and come together as one. We are strong because of our donors. We are strong because of our community advocates. We are strong because of each and every one of you who are willing to be here today and get the message out that we're here to help the community. Women trust us. 1 in 5 women in the United States has been to Planned Parenthood at some point in her life for services. 1 in 3 have been with a friend and been in our health centers, and they know us. We stand firm and strong. When Greater Texas enters a community, we stay in the community. We will be in Lubbock for decades, and we are incredibly grateful that because of our donor support, private philanthropists have paid for this health center and have allowed us to open with patient assistance funds that will bring women here, because there aren't enough options in this community to serve people who need access to care. Planned Parenthood is needed, and we will have people who will walk through protesters to come here because there is nowhere else to go for subsidized care. Because even providers who are providing it now are stretched. We have the highest uninsured population in the United States, and Lubbock has a higher uninsured population than the state. So we're incredibly grateful for our coalition partners providing health care and the healthcare safety net. It takes all of us, and all of us aren't enough right now.
So the coalition between Greater Texas is new in the last 7 years, and then the private donors, is that new as well?
Planned Parenthood of Greater Texas was founded in 1935. So our Planned Parenthood in Texas was founded in 1935 in Dallas, and we represent Dallas down to Austin, El Paso, over to Texarkana. And so our organization has continuously operated for more than 85 years. We are now responsible for and excited to be part of the West Texas community. And we will have local governing board and community board members who are engaged throughout the state. So we'll have both volunteer leaders, patients, amazing lifelong Lubbock residents like Angela, our health center manager, here. We want to be part of every community that we're in, and we want everybody to feel like this is your Planned Parenthood. So we're just incredibly grateful to everyone who supports our mission that allows us to be here to help the community.
So I have a question. You said that there are not, so would this be the only, like, women's services only for uninsured women in West Texas?
I would say there are others who provide women's health services in West Texas, many others. And the issue is there aren't enough of us. With the uninsured populations in the country, and in Texas being greater than the United States, and in Lubbock being greater than Texas, there just aren't enough resources. One unique quality about Planned Parenthood is we focus on prevention. So oftentimes other providers of women's health are inundated with chronically ill people, and sometimes it makes it more difficult to get appointments. And so because we focus on preventive health and keeping women healthy as a cornerstone of what we do in relation to women's health, we work with other providers to ensure that the community is healthier and that individuals are healthier in the community.
And I just don't, maybe Ken, do you want to just clarify that we do serve men and LGBT?
Absolutely. So Planned Parenthood is to serve any and everyone who wants to walk through our doors. We serve women, men, we serve the LGBTQ, IA community. We provide gender-affirming hormone therapy for transgender patients. We are a welcoming, non-judgmental provider. The cornerstone of our brand is you can talk to us about anything with confidence and in confidence. You will not be judged, and you'll receive the care that you need. And that's why we're here. We want you to tell us everything that we can to help you lead a healthier, happier, more fulfilled life.
And I think if that's all the questions, we'd love to wrap up here. And then again, if there's any follow-up questions, we can offer 101s over in the waiting room. And if you'd like any footage or background of the health centers and exam rooms.
Thank you.